edit out what I need to.
He'll need to edit a lot out.
Right.
Mm-hmm.
Yeah. Okay. Hello. I'm Austin Medding, and welcome to Between Two Flags. This is our first episode for the Baylor Scott & White internal medicine residency, and I'm here with Dr. Charlie Bussell. It's a good name.
It's Bussell, actually.
Seriously?
Yeah.
You're a second year.
Yeah. You didn't know that?
Bustle, like hustle.
No, it's Bussell, like you sell a bus, like you drive a bus.
But shouldn't there be like a umlaut over the U?
We didn't want to be pretentious when we immigrated from the Europe.
Okay. All right, I'll make a note.
Yeah.
Make a note of that. Okay. All right, so we'll get to some questions that I have for Dr. Bussell.
Bussell. Bussell.
Bussell.
Put it together.
Sell a bus. Okay, Bussell.
Yeah.
Okay.
Yeah.
So, first question. True or false, you chose to go to residency here because you could only click one program out of student poverty?
Out of student poverty?
Yeah. You could only apply to one because of you're poor.
I didn't realize we were going to go in that direction with getting kind of... No, I actually picked this residency because I actually was a medical student here, and I really enjoyed the program, like working with the residents. Everybody was really nice, everybody was really fun to work with, so I figured I'd jump into this residency. So I witnessed it firsthand as a medical student here at A&M, and then everyone was nice, and it was a great place to learn.
So it was false.
Yeah, that's not true.
Cool. Okay, excellent. Second question. Was the mask rule free reign to grow the most heinous facial hair possible?
This? The CDC qualifies this as a walrus-type mustache, which correctly fits under an N95. And you're welcome. And so you're welcome to the rest of the hospital. This is a gift.
So it was more safety purposes.
Safety driven, yes, sir.
Okay.
Yes, sir.
So I didn't know if you were doing like a Nick Offerman, Ron Burgundy, Tom Selleck type thing.
All three.
I'm getting more of a Michael Cera vibe, though, with it. Anyways, it's good. It's good. It's nice, full. It's full mustache. Good. Excellent. Okay. Residency.
Do you have a problem with my mustache?
Not at all. No, especially when it's covered by the mask. Have you found support? Because I know you want to do fellowship, hopefully.
Yeah.
Have you found support from the fellows, even though you're not that likable?
Yeah, I have. So I'm interested in gastroenterology, and many of the fellows trained here, and some trained from other programs, and they've all been really welcoming and eager to get involved with research. And they've been great. They've really looked past my unlikableness.
Excellent.
Mm-hmm.
Excellent.
They've hidden their dislike of me very well.
Good.
Mm-hmm.
Did you find that you missed your calling as a surgeon because you enjoy wearing pajamas and taco socks to work?
Talking about my taco socks?
Correct. Yes.
I will say, COVID has brought about many negative things, I think, all across America, but wearing scrubs all the time has been amazing.
Makes for very few decisions throughout the day.
My wife is pleased that I can't miscoordinate things because I know what I'm wearing every day.
Excellent. Follow-up question to that.
Yes.
What does your wife prefer more, the scrub choices or the facial hair?
Oh, she is down with the facial hair.
Really?
Yes.
Okay.
That's what
All right.
she tells me.
I've been informed in the past that I'm not allowed to grow much in the way of facial hair because of the Joe Dirtness way that it grows in, missing this area and this area here. But, to each their own, right? Just
Do you identify with Joe Dirt?
um,
Just like, when he's got the wagon with the meteorite pile of airplane poop?
not that part.
Not that part?
No.
Okay.
No, not that part of
Okay.
the movie. Some others.
Just a thought.
I mean, the fireworks part with the Husker do's and the Husker don'ts. So, do you teach students on wards in the afternoons about the things that you know?
I do when I know things, which is rare.
So you teach them what you know in the afternoon then?
Mm-hmm. Mainly it's they're teaching me. I act like, I say, medical student, they ask me a question. I say, that's a great thing for you to do a presentation on tomorrow. Because I don't know what they're talking about half the time.
The whole group learns.
Cirrhosis, pneumonia, antibiotics, what are those?
And pneumonia is spelled with a P.
Pneumonia.
Right. But pneumonic is not. It has an M.
Mnemonic.
Yeah,
That's
exactly.
That is actually how that's pronounced.
Yeah, we've lost track. But I was going to ask, since you did the teaching in the afternoon of the things that you know, what do you do with the other 3 hours and 55 minutes?
With the teaching?
Yes.
Because I only know 5 minutes of teaching.
What?
Is that what you're?
No, that's just what the viewers want to know.
That's what okay.
The poll.
We play movie music trivia games.
I do remember that actually. Yeah.
Yes. It goes over quite well to break up the occasional monotony that happens in a hospital.
Yeah, when you're running in between admissions and stuff.
Yeah.
Now, are you participating in our lifestyle medicine curriculum?
I am.
Right. Did you learn that pretzel Pop-Tarts were healthier in the lifestyle medicine course?
So the thing about pretzel Pop-Tarts is many of my patients think that they're healthier because they think Pop-Tarts are bad for you, but pretzels make them healthier. I don't totally get where they think that. I don't know why they think pretzels are healthier than Pop-Tarts or why by combining them they're healthier, but that is a surprisingly common misconception. And lifestyle medicine has told me that that's not the case. And something about smoking cessation and exercise is good for you, but I didn't listen to that part.
Just mainly the Pop-Tart?
Pop-Tart pretzel, yeah.
Just because the other Pop-Tarts are healthier.
Yes. Well, they have fruit in them.
The fruit.
The fruit.
You're right. Little bits of fruit.
Little fruit, yeah. Artificially flavored fruit bits with lots of food coloring.
That's right.
Okay. So why Temple?
Yeah.
So Temple is a place that exists first and foremost. It's between Dallas and Austin, Texas, and it's not Waco. And Temple is a great place because as a resident, as an intern, you can buy a house. My wife and I have a house with 4 bedrooms, which is far too many bedrooms. And then we also have a really, really short commute time. I have about a 5 to 10 minute commute to and from work. I was able to eat lunch just today while I'm on clinic service. Both of those are really big pros of Temple. It's nice because if I want to get away for a weekend trip, I can go to Austin easily. I can go to Dallas easily. I can even go to Houston. It's a little bit further, but still like 3 hours. So Temple's a really good place because it's an easy place to get into, a place to get around with, and yeah, it's a great place.
Exactly. And what would you tell people about the collaboration amongst residents here? How they work together?
There are other residents here?
Other than you, since you're so big-headed.
It feels like I got the whole team on my back.
That's right.
Each and every day.
With the 5
with the
minutes.
whole thing. I really like my co-residents, specifically my class, but the class above me, class below me. I feel like, and even the fellows too, like I feel like once I've worked with someone, even if it's just for like an afternoon one day, I can call them up with a consult question or a curbside question or even just to hang out with. I know that a lot of the residents, especially pre-COVID, were getting together and having a drink on the weekend or going out over to somebody's house. And post-COVID, it's been a little bit more difficult with social distancing and things like that. But we've been able to still try to hang out and do little get-togethers and things with the appropriate rules. But it's a really close group of people that are all happy to work together.
So what questions do you have for me?
What questions?
We're all out of time, actually. Yeah. Sorry about that. Anyways, well, thank you very much. We're just going to go with Charlie. Just going to go with Charlie. I appreciate you taking the time to interview with me today.
Thank you, Dr. Meding. It's a pleasure sometimes.